Dr. Yashica Gudesar. I'm Senior Consultant in Obstetrics and Gynaecology in Manipal Hospital Dwarka. Today I would like to explain you about hysteroscopy and the procedures associated with hysteroscopy. Hysteroscopy is a very common procedure done these days to look for abnormal uterine bleeding or any problems associated with abnormality in menstruation. So patients who come to us with a history of polyp or who have not come with any diagnosis why they are having irregular bleeding. So we do a hysteroscopy using an endoscope. We go inside the uterus and there is a camera in front and we see if there is any abnormality in the cavity, whether the lining is thickened, endometrial lining is thickened, or there is a polyp, or there is an abnormality, or we can see an endometrioma or a fibroid. And if everything is clear and everything is normal, then we do a dilatation and curettage. And in many of our patients where there is a polyp, we do a polypectomy using the same procedure in the same sitting. There is no external cut on the patient because we go through the natural orifice, that is the cervical canal. And after doing the polypectomy in many patients, if we have advised for a Mirena insertion, Mirena is an intrauterine device which is hormonal. So it releases hormones levonorgestrel 20 micrograms per day, and it helps the patient to prevent the abnormality in the bleeding, for which patients have to take regular medications, or they have to go for injectables, or they have to keep on visiting doctors for medicines. Because Mirena, if inserted, is there for 5 years. So if inserted, patients can have a little bit of spotting for first 3 months, and after that the patient get adjusted. Some patients stop having periods, some just have spotting during their periods, but they are relieved of their heavy bleedings. So I find it one of the very good procedures for patients in which we can save the uterus and prevent anemia. Patients usually ask this question that what is the side effect with Mirena? So from my side, there is no major side effect except that with Mirena, sometimes there is a creation of a little bit of artificial menopause, and we have to take care more about our bones because there is more progesterone in the we are giving progesterone to the patient. So bone health is very important. We have to take care of calcium and vitamin D, and that's it. An irregular spotting, which might be a concern to some patient, but not as a doctor or as a patient who has had a history of heavy bleeding. So, and discuss with your doctor. If your doctor is asking you to go for a Mirena insertion, I think you should think about it, because going for a major surgery is not required at early ages, and you can always go for this procedure and prevent yourself from hysterectomy.